So this has been a question that has been sort of an enigma in lung cancer research. Why do Southeast Asian people have higher risk? There could be many reasons. Air pollution has been hypothesized as being one of those reasons. Indoor cooking with poor ventilation has been a hypothesis. Perhaps there are genetic differences and so forth. But if we take our data into account, as well as other studies, it seems that perhaps air pollution is a likely factor. We're not looking at that explicitly in our model, but what we're doing to capture that risk is to model the risk specifically for Southeast Asian populations. So that's one way where we can hopefully capture whatever risk comes from air pollution, for instance, into accurate risk prediction models.